If there's one vitamin you aren't paying enough attention to, it's vitamin K2. Vitamin K2, what is it? It's a fat-soluble vitamin in the vitamin K family, but it's much different than the more well-known vitamin K1. And unlike vitamin K1, vitamin K2 has a more broad-reaching effect on multiple systems in the body, including calcium regulation, cancer prevention, hormone balance, and more. When you combine this with the fact that there's a very high chance you aren't getting enough vitamin K2, it's clear that getting more of this vitamin should be a priority. The reality is that everyone should be focused on their vitamin K2 status. But today I want to focus on why thyroid patients specifically need more of it. Here's why. Vitamin K2 is involved in calcium regulation and homeostasis. Put simply, vitamin K2 is the vitamin responsible for ensuring that the calcium in your body goes to all of the right places while avoiding all of the wrong ones. You might not think this is a problem, but it is. For various reasons, your body has a hard time putting calcium where it needs to go without the right inputs. And when those inputs are not around, calcium ends up in places like your coronary arteries, where it increases your risk of cardiovascular disease, and your kidneys, where it increases your risk of developing kidney stones. Instead of places where you want it to be, like your bones, where it prevents osteoporosis and osteopenia, and your teeth, where it helps to prevent against cavities. Let's focus on the heart for just a minute here to really drive this point home. There is a known connection between thyroid function and the heart, including cholesterol levels. When thyroid function is low, cholesterol levels will increase. This is completely reversible, by the way, but thyroid patients rarely ever reach a state of euthyroidism, so they never actually end up normalizing their cholesterol related to their thyroid problem. But back on topic. These high cholesterol levels are obviously problematic for patients with hypothyroidism, which is why these patients have an increased risk of cardiovascular disease. This connection is so strong that even small changes in thyroid function can lead to big changes in terms of their increased risk of heart disease. This effect becomes obvious when looking at patients who have a condition called subclinical hypothyroidism, which is also known as early thyroid failure. Patients with this condition experience abnormal thyroid lab tests, however, they do not experience full-blown symptoms of hypothyroidism. But even in this state, the small decrease in thyroid function that is seen on thyroid lab tests is still enough to increase the risk of heart disease, high blood pressure, and high cholesterol. Most of you listening to this right now are far beyond this subclinical state, which means that the influence that your thyroid has on cholesterol and your risk of heart disease is much more pronounced. This means that doing whatever you can to mitigate or to reduce your personal risk of heart disease is important if you have a thyroid problem. And one way to do this may be with the use of vitamin K2. Vitamin K2 has been shown to reduce arterial stiffness and slow down the effects of vascular calcification. In simple terms, it helps to prevent calcium buildup in the walls of your arteries, which makes you less likely to have a heart attack, and it makes your arteries softer and more pliable. We will talk more about how to get vitamin K2, so sit tight, but for now, let's focus on another big reason to take it, and that is that it helps prevent osteoporosis and strengthens your bones. It may not sound sexy to prevent bone loss, but it's far more important than you might realize. And this is for one big reason. Having stronger bones prevents against fractures. One of the most serious consequences of falling for someone that is older is the risk of fracture and its subsequent complications. A simple fracture of a single bone can severely impact your quality of life, increase your risk of death, and lead to conditions like chronic pain syndromes. The best way to approach bone health, at least in my opinion, is to focus on maintaining strong and healthy bones right now so you don't have to worry about conditions like osteoporosis, osteopenia, and fractures in the future. Doing this is easier said than done, especially for thyroid patients. Your thyroid hormones help to regulate the cells in your bones known as osteoblasts and osteoclasts. These cells are involved in both the building up and the breaking down of your bone tissue. If you have hyperthyroidism, which is a state of excess thyroid function, you will have an overstimulation of osteoclasts and you will experience brittle bones. If you have hypothyroidism, both the osteoblasts and osteoclasts will be reduced, sort of in tandem. However, even though your bones will remain mineralized, they still have a poor quality to them, which increases their risk of fracture as well. So pretty much no matter what type of thyroid problem you have, there's a risk that you will have a problem with your bones. And what makes this even more complicated is the impact that thyroid medications have on your bone health as well. The more thyroid medication you take to alleviate the symptoms of hypothyroidism, the lower your TSH will go and the more likely you are to stimulate those osteoclasts. So in essence, you may be trading the resolution of low thyroid symptoms right now for bone problems later in the future. The bottom line is that maintaining bone health is both difficult and critical for people with thyroid problems. As I mentioned previously, one way to ensure that your bones have calcium they need to be both healthy and strong is with the use of vitamin K2. Vitamin K2 helps to push the calcium into your bones to ensure that they have the minerals so that they can have the proper density and strength. Beyond the impact that vitamin K2 has on your heart and your bones, it also has an impact on your risk of cancer. Why is this important for thyroid patients? Because unfortunately, there appears to be some connection between having a thyroid problem and your risk of developing multiple types of cancers. And this connection can be seen from two different angles. The first is related to the use of thyroid medications like levothyroxine. Studies have shown that patients who take levothyroxine have an increased risk of developing multiple types of thyroid cancers over time. And the second is related to the dysfunction that hypothyroidism causes on the body. So putting aside the risk that may occur by taking medications for hypothyroidism, like levothyroxine, it appears that thyroid function itself has some cancer-preventing mechanism built into it. Notice I said the word correlation here because that one word is very important in this context. Right now, there's not enough evidence to prove that thyroid dysfunction or levothyroxine cause cancer, but there is a growing body of evidence that connects these two conditions together. Regardless of this exact connection, it doesn't really matter because I think you will agree with me when I say that if you can do something to prevent your risk of cancer, that something is worth doing. And this is where vitamin K2 steps in. Vitamin K2 has been shown to have anti-cancer effects on multiple types of cancer cell lines. And it may be worth exploring if you are somebody who has hypothyroidism and if you are worried about your own personal risk of cancer. Now, I'm not necessarily saying that vitamin K2 will prevent or treat cancer, but if taking it happens to provide some anti-cancer benefit on top of the other benefits we already talked about, such as improving bone health and reducing your risk of heart disease, then that's all the better. When all is said and done, it's my belief that taking vitamin K2 is a no-brainer for patients who have thyroid disease. The question is, how can you get more of this important vitamin? And here you have two options. You can get it naturally from very specific foods, or you can take it in supplement form. If you want to get it solely from food, here are the foods that you want to eat on a regular basis. Fermented foods like natto, dark chicken meat, hard cheeses, butter, egg yolks, and liver. If you aren't eating these foods on a regular basis, then getting your vitamin K2 in supplement form is the next best option. If you want to go that route, you'll want to find vitamin K2 as either MK4 or MK7. Remember, do not confuse vitamin K1 with vitamin K2 as their effects and benefits are completely different. Most multivitamins will contain a vitamin K1, but they will not often contain a vitamin K2. So you will most likely have to go out of your way to find a supplement that has vitamin K2 in it. Don't just assume that your multivitamin contains vitamin K2 because it probably doesn't. And in fact, most vitamins don't even contain K1 because they're worried about the effects that vitamin K has on anticoagulant medications. If you don't see that vitamin K2 is specified on the back of your supplement, then you're probably not getting it. The total dose to aim for would be somewhere between 100 and 200 micrograms taken every day. You also might find additional benefit taking doses much higher than this if you're trying to treat specific problems like heart disease or prevent bone loss. Vitamin K2 has been shown to be very safe. However, you still should exercise caution if you are taking any blood thinners. If that's the case, make sure you talk to your doctor first before using this ingredient. And by the way, if you have thyroid problems and you're interested in learning more about how to treat your problem naturally, I'd recommend checking out this video next.